All right, I hit the wrong button, so I'm going to have to continue with this. So, again, 1/3 of drugs are removed from the market after they get approved by the FDA because they had serious post-approval risks. Another thing that you want to know also is many of these drugs are being used as off-label prescriptions, meaning they were never approved by the FDA for that. Once the drug gets approved, that drug can be given for anything that the doctor decides to give it to you for. Those are called off-label prescriptions. So they never went through the approval process. Another thing too, most of the studies that are done on the safety of these drugs are done on pretty healthy people. And then we take them and we splash into the unhealthy community and we wonder why everyone gets sick. Another thing that I find totally disgusting, if I'm being honest with you, is that our average senior gets 25 drugs prescribed per year. Our average senior gets 25 drugs prescribed per year. Could it be that these drugs and the health of our seniors and why we just saw COVID ravage the seniors, could it be that they're all overloaded from an iatrogenic, pharmacological, allostatic stress load from too many drugs? If they're getting 25 drugs prescribed per year, and I see patients coming in that are on 5, 6, 7, 8, 9, 10 drugs, no one is looking at the big picture. No one knows what the other doctors are doing. They just all throw the drugs in the middle. Could this be why the weakest population in our society from the COVID germ was the seniors? Could it be because they're overprescribed? I would have to say absolutely yes. It must be a factor. It has to be a factor. If the leading cause of death in the United States is the iatrogenic doctor drug-induced, then we must look at our seniors who take the most drugs and get prescribed 25 drugs per year and say, hey, is that the reason why they all died like flies? What if we went into these healthcare facilities? What if we went back to our seniors and explained how their brains and their body worked? What if we explained that drugs always add more stress into a stressed out system? What if we had a true healthcare system aimed at restoring function and understanding that when you go to healthcare providers that all they have is drugs and that's it? That's not a healthcare provider. That's a crisis interventionist. That is not healthcare. Drugs are not required for health, period. They're not. So with that said, if you have any questions, please let us know. God bless you, God bless your family, and God bless the United States. Have a great day.